Are you struggling with arthritis? It could be more than just one joint pain. Most people focus on the joint, but that's rarely the full problem. If you think arthritis is just aching joints, stiffness, or a sign of aging, you're only seeing one part of the picture. Arthritis isn't just a normal joint condition. It's a whole body inflammatory disorder that affects muscle, circulation, metabolism, sleep, and even mental health. I'm Dr. Srishti Mohapatra, internal medicine consultant and aesthetic physician at the Wellness Co. And stay with me because what actually worsens arthritis isn't what most people think of. Arthritis is an extremely common and often underestimated disease. Globally, over 350 million people live with arthritis. In India, nearly 15 to 20% of adults experience chronic joint disintegration and degeneration. Osteoarthritis is one of the most common forms, affecting almost 1 in 3 adults over 60, with women especially more vulnerable after menopause. Yet many people delay care because they believe joint pain is normal aging, but it isn't. So what exactly is osteoarthritis? Osteoarthritis is the most common type of arthritis. It occurs when the joint cartilage gradually thins down with time. But it's not wear and tear. Inflammation, muscle weakness, circulation disbalance, and metabolic health, all of this decides how painful it becomes and how fast it progresses. This is where most of the treatment plans fall short. Arthritis is an inflammatory condition, not just a joint problem. Even osteoarthritis involves chronic low-grade inflammation markers like CRP, interleukin-6, TNF-alpha, which are often elevated in such conditions, which means arthritis affects much more than a joint. It impacts muscle recovery, fat and glucose metabolism, nervous system stress. And well, this is why many people with arthritis feel constantly tired, weighed down, stiff, heavy, low on energy, and that's not just the pain. If your arthritis feels worse in the morning or even after rest, this next part matters. Muscle weakness and circulation play a huge and pivotal role with such people. People with knee osteoarthritis can lose up to 20 to 30% of muscle around the joint. Now, this pain leads to less movement. Less movement leads to muscle loss, and muscle loss increases joint stress, accelerating further damage. At the same time, reduced circulation and lymphatic flow can cause stiffness and swelling. Morning stiffness isn't just because your joint worsened overnight. Circulation simply played its part and slowed down during rest. Arthritis also affects mood, sleep, and brain. Chronic pain doubles the risk of poor sleep, and this is linked to anxiety and low mood. Poor sleep, and then it increases inflammation and cortisol levels shoot up, creating a vicious cycle that worsens the symptoms around this time. Weight and metabolism are closely linked to arthritis. Every extra kilogram adds 3 to 4 kgs of pressure on your knees and 6 kgs almost while climbing up the stairs. But most importantly, fat tissues release inflammatory chemicals that accelerate the joint disintegration. That's why arthritis progresses faster in people with insulin resistance, metabolic dysfunction. So why don't painkillers solve this problem altogether? They reduce pain, of course, but they don't address the muscle atrophy, the circulation issues, the inflammation load, the sleep disruption, or even the long-standing stress that inculcates with this. Long-term arthritis care has always been multifaceted and layered. What actually is backed by science and evidence, strength training to protect joints, low-impact movement to maintain mobility, inflammation management, circulation-enhancing recovery therapies, sleep and stress optimization. Arthritis doesn't mean stopping somebody's movement. It means moving smarter and supporting the entire system pretty well. You don't have to manage arthritis on your own. With the right recovery, right movement, and medical support and supervision, improvement is absolutely possible. And I help patients do exactly that. Tell me in the comment section below what affects you more, pain, stiffness, or low energy? Or is it that anxiety that's creeping in? If this helped you see arthritis differently, like, save, and follow for more science-backed guidance on recovery and long-term health.